Welcome to Cultivating Her, the podcast where we are redefining women's health from the inside out. I'm your host, Christy Edgar, and today we're diving into something that impacts millions of women, often without them even knowing. How chronically high insulin levels, especially when paired with high blood glucose, affect our heart, our hormones, and our overall metabolic health. We're going to talk about the myths around cholesterol, how insulin resistance disrupts blood pressure, triglycerides, and fat storage, and then most importantly, how to start reversing the damage using tools from the functional medicine world. Let's break this down like we're in high school biology class, because let's be honest, that's where we should have learned all of this in the first place. Welcome to Cultivating Her, breaking taboos, balancing hormones, and redefining women's health. I'm your host, Christy Edgar, an integrative nutrition health coach and holistic lifestyle expert. Join me as we dive into the world of menstrual health, hormone balance, and the connection to women's wellness. Whether you're looking to decode your cycle, tackle PMS, or manage menopause, this show is your go-to to syncing your lifestyle with your hormonal rhythms. Through candid conversations, practical tips, and a few expert interviews, Cultivating Her empowers women to embrace their cycles and align their lifestyle to boost energy and thrive in every phase of life. Subscribe now and start flowing with confidence as we redefine what it means to be a woman with harmonious health. All right, friends, welcome back to the podcast. On today's episode, we are going to be talking about heart health, cholesterol, and the real metabolic markers we should be paying attention to. First up, let's talk about cholesterol. It's a quick biology class lesson because you know how I love science. So, cholesterol is a type of fat, more specifically, a lipid, okay? And this lipid travels through your bloodstream. 75 to 80% of the cholesterol you need is made by your liver. Your body uses cholesterol to build cell membranes, to produce vitamin D, to make bile for digestion, and here's the big one, ladies, to make hormones like estrogen, progesterone, and testosterone. So cholesterol isn't our enemy. It has an important role in our health. But let's understand the two different types of cholesterol, okay? So when we hear good and bad cholesterol, what we're talking about are the vehicles that carry the cholesterol through our body. So LDL is a low-density lipoprotein, okay? LDL, think of it as the delivery truck, okay? It drops off cholesterol to the cells that need it. But if there's too much LDL, that creates inflammation. Inflammation then causes the cholesterol to get stuck in the walls of your arteries. Okay? HDL is high density lipoprotein. Okay? HDL is the cleanup crew. It goes around collecting excess cholesterol and brings it back to the liver to either be recycled or to be eliminated. Here's another analogy. Imagine that your body is a big bustling restaurant kitchen. Okay? For this analogy, we're going to pretend that cholesterol is like cooking oil, okay? You absolutely need it to keep things running. It helps in the saute station, i.e. making hormones, lining your pans, the protective cell membrane, and emulsifying sauces, digesting fats. Without oil, your kitchen would grind to a halt. Now, how does the oil get where it needs to be? So LDL is like the delivery guy, the guy who brings the fresh bottles of oil into the kitchen. He delivers them straight to the stations, to the fryers, to the saute pans, to the prep table, so that your chefs, i.e. your cells, can do their job. But what if the kitchen is already stocked and he keeps delivering more and more oil? You run out of shelf space, bottles start stacking up all over the place, they spill, the floor gets slippery, it becomes a hazardous kitchen. That's like plaque buildup in your arteries when LDL is too high or out of balance. HDL is the cleaning crew. It's the overnight cleaning crew that comes in, wipes down the counters, mops up the spills, and takes the extra oil back to dry storage, your liver, and keeps the kitchen clean, safe, and running smooth. So here is the secret. Too many deliveries, the LDL, plus not enough cleanup, HDL, equals a messy, dangerous kitchen. But a smart balance of both, that is a well-oiled machine. And it thrives, like your body, when cholesterol is balanced. Okay? So LDL isn't inherently bad, quote unquote. It only becomes a problem when there's too much oxidative stress, inflammation, or metabolic dysfunction. Dr. Hyman, one of my favorites, calls cholesterol the fireman, not the fire. He has been one of the loudest voices reminding us that cholesterol shows up at the scene of inflammation. It is not the fire starter. All right, so let's bust a couple of cholesterol myths, okay? Functional medicine style, of course. Myth number 1, total cholesterol tells me everything I need to know. The truth is, total cholesterol is outdated and oversimplified. So functional and integrative medicine focuses on quality and subtypes of cholesterol, not just quantity. So what really matters are the LDL particle sizes. Small, dense LDL equals sticky, inflammatory, and a higher risk of plaque. Large, fluffy LDL is much less dangerous. HDL is not just how much you have, but how well it cleans up excess cholesterol and how well it reduces inflammation. The other thing that really matters is your triglyceride to HDL ratio. This is actually the best marker for telling insulin resistance. So ideally, you would want that number to be under 1.5. You would take your triglyceride number and divide it by your HDL number for the ratio. Again, cholesterol is not causing heart disease. It's the context, inflammation, oxidation, metabolic dysfunction. That's what turns cholesterol into a problem. Myth number 2, saturated fat clogs your arteries. Okay, the truth is, inflammation is the real root cause of arteriosclerosis, which is clogging of the arteries. Okay, so what happens? Number 1, inflammation from processed food, from stress, from toxins. They damage the lining of the arteries. Number 2, your body sends the LDL cholesterol to repair the damage. And then if inflammation persists, the LDL becomes oxidized and immune cells form plaque. Okay, so cholesterol isn't the fire. Again, I will say it is the fireman. If there is a fire everywhere, i.e. chronic inflammation, more firemen show up and start to cause blockages. Myth number 3, statins are the only answer. This is a big one. Truth, statins might lower your LDL, but they don't address the root cause like poor diet, high insulin, or inflammation. And statins also lower CoQ10, which is critical for heart and mitochondrial function. They also can impair hormone production in women. Okay, remember, hormones are made with cholesterol. And also, they give a false sense of security if your lifestyle isn't changed. You have to change the lifestyle. All right, and let's tackle one big final myth. Fat does not make you fat, and fat does not clog your arteries. I know that this is the opposite of what we were told in the 90s through that whole low-fat craze, right? But science, especially from functional medicine leaders like Dr. Mark Hyman and Dr. Joel Fuhrman, they are painting a very, very different picture. Okay, so let's talk about fats in our food, okay? Because some fats fuel inflammation while others heal it. Unhealthy fats are the real problem, and they are mostly found in industrialized fat. This is refined vegetable oils like corn oil, cottonseed oil, canola oil, soybean oil, safflower oil. It's all those highly inflammatory oils that I talk about. Obviously, we know hydrogenated oils, trans fats are terrible, and anything that's labeled as partially hydrogenized, which really we shouldn't have in our food anymore, but they do sneak in. You have to pay attention. Okay? And that's because these fats are unstable. They oxidize easily and they damage the lining of our blood vessels. Okay? That is one of the early steps in arteriosclerosis. I do have one more myth bust. That fat causes heart disease. Okay? This is one of the most misunderstood ideas in nutrition. That eating fat clogs your arteries and creates a heart attack. Okay? This belief came from some outdated science back between the 50s and the 70s that blamed dietary fat and cholesterol for plaque buildup in the arteries. Okay? The truth, which is now fully supported by current functional medicine and modern research, is that it is not dietary fat, but inflammation, sugar, and insulin resistance that are the true culprits behind heart disease. Okay, so let's break this down. The old way of thinking was that saturated fat raised cholesterol, which was bad. Okay, but here's the new understanding. It's high insulin and inflammation that is damaging the arteries, and then cholesterol is dispatched essentially to that area to heal the damage, right? And we talked about what happens with the LDL and the HDL and how that can create plaque in the arteries. Okay, so cholesterol causes clogs. That is the old way of thinking. It is the oxidation and inflammation around the cholesterol that matters, okay? And then the old thinking was that low fat was healthy. And the new understanding is that low fat diets often are equated to high sugar, which then leads to insulin resistance. So it's not fat that's making us fat, it's sugar and refined carbs. Even the Journal of the American Medical Association has shown that the sugar industry paid scientists to blame fat instead of sugar. Wild, right? Okay, but on the flip side, here's the thing. Healthy fats are actually cardioprotective. So they help lower inflammation. They support hormone function and even improve HDL levels. Okay, these are things like cold-pressed olive oil, avocados, avocado oil, wild-caught fatty fish like salmon, which is rich in omega-3s. You have grass-fed butter and ghee, raw nuts and seeds, and then pasture-raised eggs, because egg yolks are a wonderful source of healthy fat. Okay? And these fats don't make your blood sticky. In fact, studies actually show that omega-3s can reduce triglycerides, improve insulin sensitivity, and lower blood pressure. Okay? So Dr. Casey Means, who is a functional medicine doctor, basically emphasizes that we really need to refocus our eating for long-term heart health on whole food, fats, fiber, and phytonutrients. Okay? So instead of fearing fat, we need to fear blood sugar spikes, chronic stress, poor nutrition, and overly processed foods, okay? Because those are what drive insulin resistance and metabolic dysfunction, and those are the things that actually create heart issues, okay? That leads me to insulin resistance, okay, which is the real fire behind heart disease. Okay, so let's zoom in on what is causing the fire, quote unquote. So high insulin levels and a blood sugar dysfunction. I keep talking about this over and over and over again. When we eat sugar and refined carbs, our blood sugar spikes. In response, our pancreas releases insulin, which helps shuttle glucose into the cells for energy. But over time, especially with the modern diet of packaged food, of soda, and then of stress in this patriarchal culture that we have, our cells stop responding to insulin. And this is what we call insulin resistance. Okay, when insulin stays high, it tells the liver to make more triglycerides and LDL. It also tells the body to store more visceral fat. That's the fat around your organs, not just your waistline. And it also damages blood cells, raises blood pressure, and stiffens your arteries. So I talked about Dr. Casey Means before. Former Stanford-trained ENT turned metabolic health warrior, okay? The conversation here is that chronically high insulin is the spark for metabolic dysfunction that leads to high cholesterol, high triglycerides, high blood pressure, and eventually type 2 diabetes and cardiovascular disease. Okay? In functional medicine, they look at the symptoms not as separate diagnoses, but as signs of the same root cause, metabolic dysfunction that is driven by insulin resistance. Okay? So first, let's talk about blood pressure, okay? Because high insulin levels increase the amount of sodium in your kidneys, okay? And then the more sodium that you have, the more water you retain, and the more volume is in your blood vessels. This creates higher blood pressure, okay? It also increases the activity of your sympathetic nervous system, which is that fight or flight part. That then constricts your blood vessels and adds even more pressure. Okay, so insulin resistance will drive a change in your blood pressure. Let's talk cholesterol and triglycerides. Insulin resistance disrupts how your liver processes fat. It increases triglycerides, which is a type of fat in your blood, and it lowers HDL, which is the good cholesterol. This combination is dangerous. It leads to plaque in your arteries and is setting the stage for heart disease. Fat storage, okay? High insulin tells your body to store fat, especially around your belly, and prevents it from being burned as fuel. This visceral fat is hormonally active. It worsens insulin resistance, inflammation, and cardiovascular risk. So what does it mean when fat is hormonally active? Not all body fat is the same. Some fat just stores energy, but visceral fat, the kind that builds up around your belly, your liver, and your organs, is what functional medicine doctors call hormonally active. And here's what that means. It's not just sitting there, it's actually doing stuff. Visceral fat releases hormones and chemical messengers called adipokines and cytokines, okay? These include inflammatory compounds and also increase leptin, which controls our hunger. So instead of being neutral storage, this fat is driving chronic inflammation, worsening insulin resistance, and contributing to hormonal imbalances in the body. In functional medicine, visceral fat is often called an endocrine organ because it literally behaves like one. It's terrible and we need to address it, okay? Now, what about women? What about estrogen, menopause, and lipids, okay? So here's a key piece that often gets missed. Female hormones dramatically influence cholesterol and heart health. So during our reproductive years, estrogen plays a protective role. It helps to raise our HDL, it helps keep the LDL low, and it supports flexible, healthy blood vessels. But as we enter into perimenopause and menopause, when estrogen levels are all over the place and we're losing estradiol and we're losing progesterone, guess what raises? Our LDL cholesterol, our visceral fat, our insulin resistance, and thereby our cardiovascular risk. Okay? This is one reason heart disease is becoming the leading cause of death for women after menopause. Not breast cancer, not autoimmune disease, it's actually heart disease. Okay? Dr. Sarah Gottfried and Dr. Jolene Brighton have spoken at length about this, and they emphasize that when hormones shift, our lipid panels shift too. So we need a completely different lens for women's cardiovascular health. All right, so what are the key biomarkers that tell us about our health? So in functional medicine, the trend now is not to wait until someone has full-blown diabetes to intervene. Instead, they're watching for these early signs that are available in just a common lipid panel that is done by your doctor. Okay, so you have fasting glucose. Okay, so your fasting glucose, the optimal range should be between 70 and 85 milligrams per deciliter. Okay, that tells you how much sugar is in your blood after rest. Fasting insulin. This should be between 2 and 6 picomoles. This is how hard your body is working to regulate sugar. So fasting insulin is not commonly tested. I think if we all should be pushing our doctors to test, especially if we're getting a fasting glucose reading that's over 85. Ask for it. The worst they can say is no. Okay. Your hemoglobin A1C. Okay. This number should be below 5.2. Okay. The hemoglobin A1C tells the average blood sugar over a 3-month period. Okay. You are not going to change your A1C by eating a box of donuts the day that you take your blood test. You're also not going to change it by fasting for 2 days before. It is a cumulative reading of blood glucose over a 3-month period. Okay. And then we talked about this earlier, the triglyceride to HDL ratio. Okay, so higher ratio would indicate more insulin resistance. This is a great way to tell. So why are these important? Elevated glucose and insulin levels come years before a diabetes diagnosis. Okay, when these levels are off, it means your cells aren't responding to insulin anymore, not the way that they're supposed to, and that your pancreas is working overtime to compensate until it basically burns out. Once it can't keep up anymore, your blood sugar rises out of control and you get diagnosed with type 2 diabetes. Again, Dr. Casey Means calls these patterns early whispers that your body is telling, like whispering to you, hey, something is wrong. Pay attention to me. Do something different. Okay. So again, when we're talking about women and we're talking about going into perimenopause, and we talked about already, because we're losing estrogen, because our hormones are fluctuating, now we understand that this is affecting our lipid panel as well. We are actually less insulin sensitive, which means we're more at risk for insulin resistance. For more risk for insulin resistance, then insulin resistance is going to start playing a factor in our blood pressure and our cholesterol, triglycerides, and all of these different metabolic markers, which create good health in us. So what can we do? Okay. I preach about this nonstop. You can reverse metabolic dysfunction. Okay. You just have to think holistically. So number one, you have to prioritize blood sugar over calories. That means your meals need to be balanced with protein, fiber, and healthy fat. It means you need to ditch refined sugars, seed oils, and processed carbs, and you need to focus on whole foods that come from the earth. Period. Number two, you have to move your body, especially after you eat. A short 10 to 15 minute walk after eating lowers blood sugar and insulin levels dramatically. We've also seen the studies come out that, hourly 10 squats helps too. So, moving your body. And resistance training. Resistance training increases your insulin sensitivity and helps to raise your HDL. So move. Number three, sleep like your life depends on it, because it literally does. Poor sleep equals more cortisol, which equals more blood sugar spikes, which equals more inflammation. So 7 to 9 hours of restful, screen-free, melatonin-supportive sleep. Number four, manage stress. Chronic stress keeps insulin levels high. Practices like prayer, meditation, breath work, journaling, sound baths, yoga, all of it help you return to a parasympathetic state. That is your rest and digest mode. We want to be encouraging that parasympathetic nervous system to kick back in. Okay? And then number five, test. Don't guess. See your healthcare provider. Get that fasting insulin test. Know what the ratio is of your triglycerides to your HDL. Get your inflammation markers tested. And ideally, the size of the LDL particle, if your doctor will do that. Okay? I also would highly recommend exploring glucose monitors to understand where your fasting glucose levels are and what food is doing to your glucose levels. This is a really, really easy way to figure out, guys. This is, and actually what I teach and coach people in my group is how to start testing, how to pay attention, how to get that fasting glucose down. So from a functional perspective, instead of just throwing statins at postmenopausal women, functional medicine practitioners are actually asking, can we support the body's natural hormone rhythm? Can we reduce inflammation, improve insulin sensitivity, and use food as medicine? Okay, so those might be two big questions that you can ask your doctor if you go in and find that you have high blood pressure, if your cholesterol comes up high, if your triglycerides are out of whack. Like, these are things that you should know to ask your doctor. Okay, so what are some supportive strategies to help with that? Phytoestrogens. So things like flaxseed, fermented soy, these gently support our estrogen receptors. Resistance training and protein, getting enough protein helps to boost HDL and maintains our muscle mass. Keeping our blood sugar balanced is the key, honestly. Like, I can't preach it enough. And then, of course, we want to make sure that we're supporting our liver with milk thistle and leafy greens to help our hormone and cholesterol metabolism. There is something called sulforaphane, and that is in our cruciferous vegetables, things like broccoli and cauliflower, cabbage, kale. These all help support the detoxification of the liver. Make sure you're getting them into your diet on a daily basis. Okay? So, final takeaway is this. Our body is so incredibly smart. Okay? High cholesterol, high insulin, high blood pressure. These are not problems. These are tiny whispers. These are smoke signals. Your body is saying, hey, pay attention, help, right? These are all signs of metabolic dysfunction. And good metabolic health is not just about avoiding diabetes. It's about preserving our heart health. It's about hormonal balance, and it's about maintaining energy as you age. And that does start with understanding how insulin is driving the whole show. Okay? By tuning into our bodies, nourishing it with whole foods, moving with intention, and listening to functional medicine, you can move course. I mean, especially if you've been told that you're borderline, if you're looking at your numbers, if you know for a fact, you're like, oh, dang, Christy, I know that my A1C is high. I know my fasting glucose is high. I've already been told I have high blood pressure. You can change that, because here is the truth. Your body is not broken. It is responding to what you are putting in, whatever it's been given, okay? And when you change what you're giving it, you can reclaim your health, because when it's given the right things, the body will heal itself, okay? So I love you guys. I hope that you found tiny nuggets of information in there. And until we speak again, be kind, be well, cultivate good health. Thank you for joining me on this journey to educate and empower. I hope you found value in what you heard and will come back to listen again. Together, we're going to create a community of women empowered to transform their health. If you're excited to be part of this, please subscribe, leave a review, and share with the other women in your life who need health support tailored to that X chromosome. Until next time, be kind, be well, cultivate your health.